Hello and welcome to the program. Thank you so much for tuning in today to Health Professional Radio. I'm your host, Neal Howard. Pain affects about a third of American adults. Now, unfortunately, most physicians receive a little training in pain management, but not anywhere near adequate training. Our guest today is returning to speak with us, Dr. Jacob Teitelbaum, to talk about a new British Medical Journal study that confirms that NSAIDs increase the risk of heart attacks. Welcome back to Health Professional Radio, Dr. Teitelbaum.
Neal, it's great to be with you today. And, this study really outlines just how important it is for doctors to be up to date on the new information, which is that actually all pain can be effectively treated if you use the entire toolkit and go after the root cause of the pain. So we'll talk about that today. And also to realize, like you mentioned about the new study, and that new study, it's a British Medical Journal, about 500,000 people in a meta-analysis, 500,000 patient years, found that NSAIDs increase heart attack risk on the order of about 35%, and also stroke risk has been shown to increase even several 100% in people taking long-term NSAIDs. And there's a number of theories as to why this is going on, but most importantly, that translates out to about 40 to 50,000 preventable U.S. deaths a year. And I'm going to tell you preventable in a moment because there are alternatives that have been shown to be more effective and much safe.
This pain that we're talking about, NSAIDs are kind of a staple of pain management. Is this new, or have we suspected this and just needed some studies to confirm what was already suspected?
We suspected this because the studies have shown for years that there's approximately 16,500 bleeding ulcer deaths in the U.S. from NSAIDs, and that there's different studies go from about 4,000 to 16,500 people a year dead from even just that piece of it. So this is kind of just the icing on the cake. This is a massive study that confirms it. So as a doctor, if you don't know that 50,000 people are being killed each year by NSAIDs when you're prescribing them, if you're not taking that into account, how can you possibly come to a right decision on what to do for people? To put that in perspective, there's 15,000 U.S. deaths a year from prescribed narcotic overdoses. So it's a little under one-third as big of a problem in terms of absolute numbers. So the good thing, though, Neal, and why don't you go ahead and go through, what I'd like to do is give doctors a little bit of a background in terms of the new concepts in pain management that make this whole issue moot.
Please do.
There's not a question of do you leave people in pain or give them narcotics. That's a crazy Sophie's choice to be put into. The door number 3 is here's how you get them pain-free, and by treating the root cause of the pain. So, Neal, a key concept for people is that when we're treating people with pain, it's critical to realize that pain is not an outside invader. It's not like an infection or something from the outside we have to fight. Pain is part of our body's monitoring system. It is basically like the oil light on our dashboard. And what our research has shown is that when you give the body what it needs, just like putting oil in the car, how do we treat medically if an oil light was flashing? Would put a Band-Aid over it and an NSAID, and then the motor would burn out. And we'd go, gee, I wonder
yeah, absolutely.
why the person is doing so poorly and having these problems. And then maybe we'd cut out the oil light or smash it with a hammer. But what if you just put oil in the car? Put oil in the car. Oil light goes out. And our research done on people with fibromyalgia, which is the worst kind of muscle pain, and most pain in this country is caused by tight muscles. Our study showed that if you give the body increased energy production with what we call the SHINE protocol, that means optimizing sleep, optimizing hormonal support, treating infections, nutritional support, exercise as able, those 5 things, 91% of people with fibromyalgia improved with an average 90% increase in quality of life. So there's after study after study after study showing that if you give people what they need, what the pain is telling them they need, the pain will go away. So so we go through each different kind of pain and tell people what that body's warning light is asking for.
with heart attack, I do believe heart attack's the number one cause of death here in the United States. If I'm understanding correctly, lots of these people who, fibromyalgia, other types of, as you say, tight muscle pain or any other pain that calls for a standard NSAID, that would, do you think that would drastically drop the number of heart attack deaths? Just heart attacks in general. Would it stop being the number one cause of death if people were to stop using these NSAIDs in such large quantities or at all?
Quite possibly, because let's take a look at some of the studies for the arthritis. Head-on studies show that a special mix of curcumin, boswellia, DLPA, and nattokinase, 4 nutrients or herbals, was more effective than Celebrex in treating arthritis after 6 weeks of use. The combination was one called Curamin, Curamin. People can get them in most health food stores. They can go on Amazon, get online. It's easy to find. I have them take 1 or 2, 3 times a day. They can take it along with any other medications. Give it 6 weeks to work. Most of the time, they're going to find they don't need the NSAIDs because their arthritis is so much better. And the research shows that instead of increasing heart attack death risk and things along those lines, that it likely decreases Alzheimer's risk, has dramatic effects at being cancer protective, the degree of effect that, and this is now being looked at in over 100 studies looking at the curcumin component, has a degree of effect in cancer similar to many chemotherapy agents.
That's
but
huge.
Instead of its side effects, you get side benefits. And the list of side benefits, decreasing inflammation, which is a key component to heart disease, it really, instead of the side effects, you get side benefits. Instead of deaths, you look at glucosamine sulfate. The study showed that and chondroitin equally effective to Celebrex. But the study showed the people taking glucosamine were 17% less likely to die during the study. So you get these side benefits. So arthritis, easy to treat naturally. And to make it easy for listeners, write down this phone app because it's a quick, free, handy reference you'll have in your pocket. You can look up each kind of pain, and it'll go through what the best of the natural and some of the prescription options are. So if you want to use a whole toolkit for people, the name of the app is Cures, CURESA-C, so Cures A to Z. But let me give one more tip, if I could, on migraine headaches.
Sure.
Just to get an idea of the power of this information. If you have somebody coming into the ER with a migraine headache and you're trying to figure, oh God, do I give them narcotics, or I'm afraid to do that now, should I give them, what do I do? Here's a simple trick. Give them 1 gram of magnesium. Give it IV over 15 minutes. 2 double-blind studies have shown that it will eliminate migraine headaches completely for that attack within 45 minutes. In about 85% of cases, the headache's gone. It's much more effective than Demerol. And anybody who wants to get information and wants copies of, if you want the references for anything I'm saying for the studies, I can give my email address if that's okay with Neal, or should they contact the station?
Pain causes depression too. Are there, you say, some side benefits as far as that curcumin and other stuff as far as depression?
Well, the curcumin in a form called Curamed. For curcumin, you have to use a special highly absorbed form, or you're going to be taking 500 pills. But the form that's called basically Curamed has been studied for depression, and in head-on studies against Zoloft was much more effective, especially for moderate to severe depression. Again, after 6 weeks, the dose on that was 500 BID. I'll give 750 BID. But this was also a blinded study, but a head-on study.
Where can our listeners get some more information about you, your latest books, any of your books, and also about this latest British Medical Journal study?
If you want to email me, my email is fatigue, FATIGUE, doc, DOC, at gmail.com. So fatiguedoc at gmail.com. Be happy to send you the links or the study references, but also get that Cures A to Z phone app. It's a free app. There's a $2 upgrade. It will make you an expert on all of these things in 30 seconds, as long as it takes to download the thing.
Thank you for the information, and thank you for coming back in and talking with us again.
Neal, always always a pleasure.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with returning guest Dr. Jacob Teitelbaum. And we've been discussing a new study published in the British Journal of Medicine that associates the risk of heart attack with NSAIDs. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure to visit our affiliates page when you visit our platform at hpr.fm.